And welcome. Hello, this is your host tonight, Reverend Dr. Carl Matthews. And I am filling in tonight for my good friend and the host who normally is navigating this show, Reverend Dr. Robert McKinley Gilmore Sr. We want to pray for him while he's recovering. And we give a shout out to you, my brother, that you hope that you get well and take your time, and we'll see you in the next episode. We want to welcome you to the Public Access TV, the Houston media source. We have some very interesting guests with us tonight, and we're going to be talking about mental health. That's right. You know the storyline. We've been talking about that for the last several months, and just talking about the disparities that exist in our communities, the stigmas that exist in our communities. I have some very distinguished guests with us tonight who's joining us, and I'm going to allow them to introduce themselves, and then we'll begin our show. And to my left, I have my good distinguished friend, Pastor David Charles. Go ahead, David. Tell us about you.
I'm Pastor David Harrison. I pastor First Church Heights in Houston, Texas, as well as I'm an adjunct professor at the College of Biblical Studies. I'm just excited to be here today. And when it comes to mental illness, I'm not just a client, I'm also a president.
Wow, amazing.
Yeah, I like that. I'm Troy Marsaw, President, CEO of Onsite Counseling. Onsite Counseling is one of the providers that provide behavioral counseling, mental health care in the HISD school district, as well as in skilled nursing facilities around the country for those that are in need of those services.
Awesome. Thank you. I told you we have some very distinguished guests with us tonight. You know, just recently in the news, we saw an incident where the rapper Mr. Bun B and his gated community was attacked and assaulted by a young man who came in his home. And one of the things I recognized in the media as they were talking about it is the effects that he will have, and as well as his wife, as a result of having to protect his family by shooting the intruder. I imagine those type of things can be very traumatizing, and if not appropriately addressed in an expeditious manner, it can fester.
Absolutely.
And sometimes cause some other situations. What would you do in a situation like that, Pastor David, if maybe a member of your church who probably experienced such a horrific incident?
You know, one of the things, Dr. Matthews, that I've discovered with mental illness is like any other illness or injury. So if you break an arm, if you fracture a leg, you have to get it set. Mm-hmm. You see it. It has to be x-rayed. It has to be treated. It has to be cast. It has time to heal. But when it comes to the mental effect, the same break happens in the mind, whether you are suffering from a chemical imbalance or a traumatic incident, but you just don't see the physical break. And that incident left untreated in the brain, all of a sudden, it begins not only to deteriorate that portion of the brain, but it also affects that person, and just like an injury not treated, it gets worse.
Yeah, it's interesting you should say that, because normally we start our show off with the World Health Organization definition about that. My takeaway from that is that it's simply just that. Anything that disrupts the normalcy of your ability to be able to cognitively process, you now have been affected.
Absolutely.
I never shall forget, I was at a restaurant and I was talking about mental illness as I was trying to wrap my mind around it for the sake of being able to be effective in my ministry. And a young lady was laughing, and so I found that kind of interesting. So I said, so what's so funny? And she said, you. I said, really? I said, so let me ask you a question. What does mental illness look like? And she said, everyone in the room. And I thought that was quite interesting, you know. So Troy, tell us. You know, you have a counseling program for mental health. How would you view that in interacting if that had been maybe a student that was in HISD school who had perhaps witnessed their father protecting them, but had to go to extreme measures? I mean, how would that kind of be viewed, or what's the process for that?
Well, unfortunately, what I've seen in the dealing with the kids that are marginalized, they have seen and witnessed much more than the average person already in their lives by the time they're 12 years old. And so for them, it becomes normal. And so when they see that murder, domestic abuse, it doesn't move them as much as it would someone out in, say, suburbia that's not accustomed to seeing that. If they are, it's hidden. And so they are able to just process that as everyday normalcy activity in their area. And so you have to almost break them down and start them all over to let them know that this is not the way life is outside of this area. So it's just something where you have to catch them, if possible, at a very early age, to reinforce that this is not normal.
It's interesting you should say that. You know, Pastor David, you talked about a comparison analysis with a chronic illness or a broken bone or a fracture, and how you would have to reset that. And based upon what you just said, how you have to reacclimate someone, it's interesting. There's no process for detoxing for psychological abnormal behavior. No. I mean, you know, it's interesting to me that no one is really kind of going into that zone. How do you connect, plug into someone to help them understand that normalcy is really an abnormal behavior when they've kind of been exposed to that?
I've discovered that 13.9% of Americans are African American, and 13.9% of African Americans suffer from 17.9% of mental illness. That's 6.2 million people. That's more people than Chicago, Houston, and Florida. And most of those people, 1 in 5, don't have the adequate insurance to even get treated.
Right.
So part of the problem is treatment. Like you said, there's no treatment available. Like Troy said, there's no treatment available, and if the treatment is available, the treatment is only a Band-Aid when some people, when it comes to mental illness, need surgery. Would you agree, Troy?
Yeah, and one of the things I've found, you know, when you think about it, when you talk about insurance, and I hate to say this, but it's true, when it comes to black and brown, insurance companies feel as though it's a normal process. So what they would do is say, hey, listen, we're not going to give you authorization to treat, even though it may have been a traumatic experience for that youngster, because, you know, we just don't believe that they need that. We have one insurer in Houston-based, Texas Children's Health Plan, who has 459,000 members. And of that 459,000 members, they only have about 8,000 providers to provide for that number of individuals. And they're saying that we don't need any more providers. But then they're not allowing the providers, they're not giving them authorization to see the kids. So what do you do in a situation like that? Where they have insurance, but the big insurance company is saying, we don't think they need it. So that's an issue in itself. So there's a lot to fight through. And the reason that they do that is because I believe the reason that they do it is because if the pipeline is from school to prison, they're not going to mess up the money trend. So most of them are on what they call capitation, which means that each month they get so much per kid, right? So last year, Texas Children's Health Plan collected about $982 million from the state. Well, if they don't use that money, if the member doesn't use that money, they get to keep the majority of that money. So it would benefit them more not to give an authorization because you don't need to change black and brown. They're going to be okay. If they don't make it here, they're going to be in the penitentiary anyway.
We're going to take care of them,
Yeah, so we're going to take care of it that way.
It kind of sounds like to me, and I have to go here with it because that's the first thing come to my mind from a spiritual standpoint. When the man was in the graveyard, after Jesus and disciples arrived to the other side, they meet the man who's possessed with legion, many demonic spirits. Jesus delivers him. The demonic spirits goes into the swine. They go into the sea, Dead Sea, supposedly. And as a result of that, instead of them rejoicing for the man's deliverance, they got upset with Christ for delivering the man.
Absolutely.
And when capitalism becomes more of an interest with capital gain than human life, then it suggests to me that there's a disconnection even in our leadership who run this country. Absolutely. Even with those startling statistics that you're giving about how many African Americans who are affected with mental health or mental illness, then what does that say about the people who making decisions and legislation and pharmaceutical companies and the medical health, that's criminal.
Yeah. But Dr. Matthews, I really have to be honest, it's what we call in counseling dual responsibility.
Yeah.
There's no one party more responsible than the other one.
Right.
And sometimes we have to look for the not so obvious bad guy. You know my story.
Sure.
When it came to mental illness, I came from one of the roughest neighborhoods in Houston. And when I was struggling with my mental illness, I was told, and I quote, black folk don't have no mental problem. That's a white folk problem.
Right.
You go to church, you go have you something to drink, you go get you a woman, don't worry about it, it'll be all right.
Sure.
But that led to my suicide attempt and me taking a 12-gauge shotgun and shooting myself in the chest. Because my culture did not deem mental illness sufficient enough to even be treatable when I had federal insurance.
Wow. So you never received any treatment, any diagnosis for it. In fact, you were denied, turned away, and you were given alternatives which could have led to a deeper addiction, alcohol,
Absolutely.
or even drugs.
Absolutely.
Yeah.
Instead of saying, hey, man, I don't really understand it. I don't think you're crazy. I know you. It may be something wrong. Why don't you just go talk to somebody? If you don't trust someone from the Anglo community that's a therapist, why don't you go find an African-American therapist? Find somebody to talk to that can get you through this bout of depression, anxiety, and PTSD.
See, and that's one of the things that I loved about the American Leadership Forum, as they put forth a good effort to bring people from different walks of life and cultures to bring us out of silos.
Yes.
Because there is a cultural change. I mean, we just don't process the same way. We don't communicate the same way. And so the point being that it was a stigma in our community if you was to talk about therapy.
You're crazy.
That was it. You're crazy. However, in the white community, therapy is a norm. It's very much accepted. It's very much received, and they receive the type of treatment. But then the other side of that coin is that they also have adequate resources to get the treatment, and many of us in our community don't have those or access to those resources to get the treatment.
Troy, may I ask you a question, since this is your business and professionally, because I want to know, and I'm sure the viewing audience want to know, and Dr. Matthews wants to know, when a child who may have that Texas Children plan is not black or brown and they come with the same cry, are they more apt to get acceptance and to get cleared for treatment versus one that's black or brown?
Well, I can't say that.
Okay.
But I can say this. Most of TCHP, when I say Texas Children Health Plan, most of those kids are on Medicaid.
Okay. Got it.
So this
that changes the playing field.
Right.
Yeah.
So if you're saying the majority of them are going to be probably black or brown, okay? And so I can't really measure any other way because the majority of them are black or brown. So here's what happens though. If a kid comes to my office from, say, suburbia, then it's a different story. They don't have to worry about, most times, getting approved and being seen. But the problem that we have in HISD, and because it's more marginalized, is that they deny. Even if we say it's emergent, they will still deny.
The client, you mean?
Yeah, so here's the game that they play. So they'll say, well, we need documentation to support the treatment of that child. Well, if I've never seen the child has never been anywhere to receive treatment, what documentation can I give
provide
you?
you?
That's the game.
So what needs to happen for that to change? I mean, is that a legislative situation, or is that a policy that we need to? I mean, how do we need to impact that?
Citizens of Houston, Harris County, need to go down there and protest.
Okay.
Texas Children's Health Plan. There's a total of 22 managed care organizations in Texas. Texas Children's Health Plan is the only one of the 22 that's playing this game. But they also have the most members. And so 459,000 is what they brag about on their website. So imagine this. If I have the highest number of individuals as members in my network, and I'm getting capitated money each month, that means if they don't touch that capitated money,
It accrues interest
it goes to the health plan.
to the health plan, right?
So it benefits the health plan. So now, if I don't allow, say, if it's 459,000 people, members, and I only allow, say, 8,000 total providers in the state of Texas in my plan, that means that even if the kid needs help, they're going to have to wait 3 to 6 months to get that help. So guess what? Who's willing to wait that long? And if they're willing to wait that long, we hope that they don't show up 6 months later and we still get to keep the money.
And even if they do show up, they don't get the adequate care.
Yeah, and listen, one treatment, an assessment, does not mean you're healed or cured.
Right.
I need to see you on a regular basis.
It's been identified.
Yeah.
Yeah. So how could the faith-based community get involved to help bring some awareness and education and information for their parishioners as well as the communities in where they work? I mean, how do we address that?
One of the
Faith
things
Center.
I'm doing at First Church Heights is, like I told you, I also teach at the College of Biblical Studies, and as well, I'm the president of Therapon Bible College and Seminary, and we have begun to mobilize biblical counselors. But the problem with biblical counselors is this: if someone has a need that can't be met within 3 sessions, that person needs to be referred out.
That's right.
This is the issue, Dr. Matthews, that I face. That if a person comes to me because of my background, I can tell whether they need to be medicated in order to hear the Bible. Because from the faith-based perspective, many nouthetic counselors believe that if a person is suffering from mental illness, the Bible is all they need. As a pastor, preacher, Bible college professor, I agree that the Bible can solve the ills of man. But if that person is struggling and they can't process the Bible, they need something to cue them in order to be able to find the information from the scriptures to get better. So I believe the faith-based community needs to partner also with the medical community.
Yes, sir.
Jesus is not afraid of medicine. Didn't Luke write a book of the Bible?
That's right.
So why are we afraid to trust these other entities and say, how can we work together for the best of people? I'm not concerned with everybody coming. People, if they're going to be saved, they're going to be saved.
Right.
And my point is to give them the help they need, whether they come to the church or not.
Well, you know, I'm glad we have another guest that's here with us, Dr. Higgins, who's been a part of our panelist discussion. We've enjoyed his professionalism, his knowledge about this craft, this field, this discussion. Dr. Higgins, you've kind of had a chance to hear what we've been talking about. What's your take on everything you've heard thus far?
Well, I would just piggyback on what the pastor said here, which is the thought of too often we see that there's a separation, or we create a separation between medicine and the church. And there is no separation between medicine and the church. But typically you see that more so in the black community, more so than in other communities. And I think that comes from an issue of just not trusting the medical model itself. So often that so often medicine has been used in our history as a negative source versus than a helpful. So I think that kind of leads into that thought of, well, I'm gonna rely on God because I cannot rely on man because man has not done me quite well in this country. So I think that's where some of those barriers are. But the church being able to engage and recognize when it becomes a medical issue, and when it becomes a medical issue is, as you talked about, cognition, or the inability to get to the point where you can even hear or receive the word, which basically means you've become disabled.
Yes.
When you've become disabled, that's when you need to get in to see, need to see the psychiatrist. Sometimes a therapist can help you as well. They tend to go a little bit deeper than your biblical counselor so far as their training. But then sometimes even they can't get you to therapy because mentally you're not there yet. Yeah. And that's where, you have the psychiatrist as that backstop and being able to access services, as Troy was saying here.
Absolutely. And I think you mentioned the key thing that my takeaway from that is liability.
Yeah.
Number one, skepticism. Because when you have a person like the CEO of Insys Therapeutic Pharmaceutical Company, John Kapoor, who was arrested for his behavior in providing a drug that's supposed to, I guess, prevent cancer, and, paid out, I think his assets grossed him $1.8 billion. I guess you have a right to have some skepticism to some degree. So I guess we have a lot of work to do in terms of tearing down the barriers of skepticism, helping pastors understand that it's okay to open up and have those strategic partnerships for the sake of having an effective ministry and effective cause for someone to be not only recovered but delivered as well. And we can see the power of God.
Yeah, but the other thing, though, y'all haven't touched on is that, think about this. If I'm trying to climb the ladder in corporate America, and I'm African American, most times I'm the, what y'all call last hired, first fired. Now it's on my record that I have a mental illness, so I'm going to see some type of provider psychiatrist. Now, they don't know whether or not that's going to ever get out. And so that's fearful to them because guess what? Now I'm labeled. So now the path I was trying to climb that ladder, now there may be some obstacles because now my seniors are going to look at me and say, well, wait a minute. Is he stable enough to lead? Because
Well, you hit it.
he has a mental illness.
In the workplace.
Yes.
And you're right. So, I have sat in the circle with people who are very affluent in leadership positions in terms of decision makers in courtrooms, of correctional facilities, of the pretrial services, in every aspect that you want to name, who have a history of diagnosis of mental challenges. But they're not being viewed the same way.
Now, I don't know about Dr. Higgins because he's out in, what is Friendswood area? So let me tell you what happens in my suburbia facilities. They don't come with insurance. They pay cash. They have the best insurance, but they don't want insurance. They want to pay cash. Why?
Documentation.
No trail.
No documentation, no trail. So African Americans, a lot of them can't afford to do that. So they don't want to take any chance whatsoever of that going anywhere other than that office and out that door. And so there's a difference.
Well, we always have to worry about the issue of stigma, when it comes to mental health. And a lot of that stigma is just a lack of information and ignorance, and that leads to people hiding and then not receiving the help. But I tell people, we don't take into account how common mental health issues are, in that we don't talk about it, so we don't think it happens. But it's happening all day, as you know. People are accessing services all the time. And people say, well, if this shows up on my record, then what will happen? Will I get the job? Will I keep the position? Will I get the next promotion? It's something to worry about. But I tell people there are very few jobs that will keep you out because of a mental health issue. I mean, being a Secret Service, that may keep you out of being Secret Service. It may keep you out of being an airplane pilot, but you could definitely be president of the United States and have a mental health issue. So there are some things that you cannot get access for, but I have, seen people with a lot of, high-level top secret clearance who have a known mental health issue. The question becomes, can you perform the job? And if you can perform the job, there's very few things that will keep you out. In that, HR knows that a lot of people around have a mental health issue, but sometimes you do fear that judgment, and sometimes can even face that judgment on the job.
So let me put it out here. So if the pharmaceutical company has been to some degree, like the tobacco company, took responsibility for their sales and contributing to chronic illnesses, but if the pharmaceutical company was to take that same position and put $20 million on the table, I think we have a good group to talk about what would be a suggestion of a remedy for being able to address these problems that we have.
I would say outreach.
Yeah.
Really outreach is number one. You'll find with most pharmaceuticals, and I'll say that I do speak for some of them, and I've spoken in the past. And I think this is a requirement, they do have a community outreach arm in what they do, but you also have to be very careful, realizing that there is capitalism involved and people are involved in selling something.
Yeah.
So you have to there's a need to look at and measure how much is too much and how far is the reach, and then, are you actually educating the public, or are you just trying to move your product? Mm-hmm. So there's always that line that always has to be looked at on whether or not you're crossing it. But getting the outreach out into the right places and having the right people on your boards to know how to reach those people. So often when stuff comes out, it comes to us last. Mm-hmm. If you look at, medications, we tend to be the last ones to get the new stuff. Even when you looked at HIV, I remember back in the late mid-'80s when a lot of people were dying of different tumors and things of that sort, and these weird pneumonias popped up and all these people started dying. It had come out to the other white male community very quickly, but it didn't come out to the black community. And we were about 5-10 years down the road, and the resources didn't really hit until the mid 2000s. When the resources hit, you actually saw a turn in the tide. So the need to be able to get those resources in to our people to educate folk is key. But are the companies willing to focus their time there? Because so often people focus on their own folk, not on the other folk who are not in the room.
Yeah, and that outreach has to be more than just a billboard. It has to be more than just a signage on the side of public transportation. It needs to be a person. It needs to be some creative, innovative things, and I think many times they don't view the faith-based, David, as a outlet or entity that can be boots on the ground to really disseminate information to the community, and that we can partake in having that partnership with the private sector to have resources and information to, impact our community.
Dr. Matthews, I have a very different dichotomy, as you know. Mm-hmm. You visited our church. I'm the first African-American pastor in the history of the church that started in 1904. I was the first African-American to go there and join and get in and get involved. And now we're about 60-40. Also, we have Indian, Asian, everybody. And when they hired me, they knew I had suffered from mental illness because I don't hide it. I took Zoloft. I still have a standing prescription for sertraline just in case I feel that monkey getting on my shoulder.
I see.
Because I have learned how to understand from proper treatment from amazing people like you guys and strong people that I can talk to when it's time, physician, to heal yourself. Mm-hmm. See, a lot of people, when it comes to mental illness, they feel because they feel better, they're getting better, they don't need to continue to seek treatment.
Continue care, yeah.
One of the things I know, and I will ask you this, brother, is when a person gets better and actually starts performing after coming through mental illness, should they continue treatment, maybe less frequently, but not as often, even though they've recovered?
I think that question is better for Dr. Higgins, being a psychiatrist. From a business standpoint, I would say, you're talking about capitalism, personally, I don't think that you recover.
Good. Absolutely.
Yeah, from a mental illness. Now, from a medical standpoint, he may differ.
Okay.
And so, but for me, think about it. How do you measure? How do you measure? There's no way to measure. And so that's what frightens insurance companies more than anything. Because guess what? This is a runaway train. Because if Dr. Higgins said, you know what, this person needs to treat for the next 2 or 3 years. Now, he's not going to say that right away, but I'm saying if this person is treating, there are people that have treated for 5 or 6, 7, 8, 9, 10 years. That's money that's coming out of their pocket. How long will this go on? How do we control this? It's not like you said a broken arm. I know a broken arm would be ready and reset in place
12 weeks.
in a certain area to go. So this here, what he's got me on a path that I don't know what could possibly happen. And so if I have 459,000 members, my God, this could
break me.
Yeah, well, you're looking at the need for, there's the acute phase and then there's the maintenance phase of treatment. Well, there's the emergency, like we got an emergency that we need to get a handle on, is safety. There's an acute phase to get you better, and then there's maintenance so far as keeping you at your optimal. I would say that mental health is so common, like I've said before, we're the most common specialty. So behind primary care, be it family medicine, internal medicine, pediatrics, the next most common doctor is the psychiatrist, then the OBGYN. All right, so it's that many of us. I would say I do have individuals who are not on medications who just want to pop in and just kind of see how things are going. Doc, this is what's going on. I just want to have a maintenance of how am I doing right now. The sad thing about mental illness is that many times the last person to know is the person who's suffering. Your behavior is acting out, but you don't notice that your behavior is acting out. So many times they'll come in for that, but generally, I would say the majority of patients will see someone periodically off and on for the rest of their lives, but not everybody. Not everybody, but the majority who require medication management and treatment will need to see somebody off and on.
With Dr. Matthews, one of the things I will say from the faith-based community is there's a lot of ignorance, and we spiritualize everything.
Sure.
And we blame the devil for everything.
Right.
Some mental illness in the African-American community, the devil's not causing.
Exactly.
Some of it is an imbalance. Some of it is situational from some things they've saw. You don't understand the traumatic impact a kid has when they see someone get shot. Even though it doesn't affect them then, later on, that could resurface. And a lot of churches, they literally, and I'm going to say it, they lie to people and tell them just pray, it's going to be okay. Well, that's true. You need prayer and.
Right.
And I think pastors need to be first educated.
Sure.
And understand the dynamics of mental illness and appreciate and understand that theology may be the queen of sciences, but other sciences are necessary in order to produce a holistic person. And when we do that, what we do is we actually make other communities realize that we are not legalistic, or we're not being dogmatic, or we're not saying we're better than everybody. We're saying that we're a part of the whole, and we want to be a part of the solution and not continue to widen the divide. I believe more churches, especially in the African-American community, like W.E.B. Du Bois said in the 60s, will be to the detriment of the African-American community. Because we literally pull everybody into our churches and we make them dependent on the preacher or the pastor, and God is nowhere in the equation.
Let me ask you guys a question. Being pastors, I give you a situation. 13-year-old girl was talking to me at one of the schools, and she says to me, I'm pregnant. I'm 13 years old and I'm pregnant. So that's unfortunate. I say, my goal is to encourage and motivate and say, you've made a mistake, but life doesn't have to end here, it can get better. So she goes on and says, well, I'm going to be having my baby in a few months. And I said, well, did you get pregnant by another student? No. I said, well, who are you pregnant by? My granddaddy. So I said, what do you mean your granddaddy? I've never heard this. It's the first time I ever heard a situation like this. My granddaddy. I said, your granddaddy? She says, yeah, I live with my grandmom and granddaddy, and every night he comes to get in the bed with me, and my grandmama knows. And I said, well, does CPS have you reported to them? And she says, no, I don't want to report it, because if I do, they're going to remove me from the home, and I'd much rather be there than in a group home with people I don't know. And so what do you do? Is that a pastor issue or is that a mental health care issue?
That's a not aware issue, because oftentimes that does not come to pastors. Wouldn't you agree?
Yeah.
It's not many times that the family, first of all, that should be an embarrassment to that grandmother who don't even accept the fact what her granddaughter is saying for whatever reason. And the likelihood of it coming to the church for us to address that, which we know the legal liability would be to have to report it
Yeah.
to the CPS. And so, to keep from being liable, you have to follow the fiduciary process.
So as a pastor, though, what do? Do you counsel or do you refer out?
Well, when something like that as a pastor happens, if it happens to me, normally, and Dr. Matthews will tell you, normally when we hear about it, it's when they are looking for a character reference, when they're wanting somebody to help somebody out. But the process of what we have in place at our church that's already written, we are not a reactionary church. We are ready to go forward in a responsive way. If someone comes to me and tell me a child's being abused, first thing I'm going to do is call the authorities, because that is my liability to the law.
That's correct.
That's the first thing I have to do. It's not to pray, it's not to counsel, it's to make sure that that child is safe. Now, this is the problem. What am I willing to do as a pastor if that child is going to be taken from that home to ensure the safety of that child? Do I have something in place where I have a group home I trust? Do I have members in our church that I trust to do them? And that's why I believe a lot of people don't report it, because when they tell the church prays, the church helps them with one situation, but the church is not able to help them with aftercare. So they don't tell them. And the church has no integrity like the therapist does. And in the disguise of prayer, they say we need to pray for such and such because she's been molested by her grandfather. That's gossip. That's not telling the truth in love.
Well, I would say there's so many people who will need to be involved in that. One, obviously, as we talked about, CPS. There's going to need to be lawyers.
Yep.
We're going to need social workers.
Mm-hmm.
You're going to probably need a psychiatrist at some point, obviously. Psych is going to end up seeing her at some point. We need an OBGYN. So there's a whole lot of services and things that need to go into. And then you got to look issue of incest, and lack of chromosome mixing.
Yeah.
The services for the child. I mean, that is going to be a rollout that's just going to be and touch so many folk, so many lives. She's going to need it. She's going to need insurance. She's automatically now on Medicaid, and then you have to look at the family trauma. That if grandma knew that grandpa is sneaking out her bed to go in your bed, because obviously she has to know where she's going. Grandma's probably had some trauma. Typically, if you're an abuser, grandfather's had trauma, and I bet money that other grandkids, other kids, generational trauma that is being perpetuated, where essentially they're going to need all that, and they're going to need some church. If they're a church, God-fearing people, then realize, as they talk about, curses go 3 and 4 generations. So essentially, the trauma that she's received, that's going to perpetuate until there's some sort of intervention.
Well, see, the problem with that is the embarrassment.
Yeah.
Right.
And so guess what? No one wants to talk about it.
Yeah.
So we hide it and push it under the rug.
Mm-hmm.
Because if you knew about it as a pastor, and now you get to judge me because you knew, and I've revealed, or the granddaughter's revealed that she knew. Now you're judging her. You're going to judge the grandfather, and they don't want that, so they rather just keep it quiet. And that's the issue you have. And these people go on through life, and you wonder why they do some of the things they do. But there's a whole lot of situations that you wouldn't believe that we encounter that most people couldn't even imagine.
Trent, I'll be honest with you. I am by no means a little Jesus. By no means am I the only church that's trying to do what's right. Yeah. By no means. But we have integrity.
Yeah.
We have a no judgment zone at our church. Mm-hmm. Because every sinner has a future and every saint has a past. Christians will get to judge one day per the scriptures. We will even judge angels, but this is not the day.
Right.
And one of the things I try to do is surround myself by people at the church that are based on Galatians chapter 6, verse 1. You that are spiritual, restore. You do not have people in place in the church who are immature. You do not have people in place at a church because they give or because their mama and their daddy was a pastor. You have people in place that you know you can trust, that are integral, and that don't mind finding other resources and are not closed-minded to help people. Because it's true, people will come to the church before they go to other services. Because the church is supposed to be free. But the reason they don't come to the church is because there's no integrity. And oftentimes, Dr. Matthews will tell you, most pastors aren't even trained.
Yeah.
And you know that's why the education information piece, I concur with you, Pastor, that's so needed. I know Dr. Gilmore and myself work with various ministerial groups. It took us 3 to 4 years to get them to understand even the conversation or willing to participate in the conversation about mental illness, right? And the statistics that 1 out of 4 in your church even have a mental challenge.
Yeah.
You see. And then secondly, being willing to work outside. It's okay to color outside the box, to have those innovative approaches. I think you touched on something very important when you say not only education, information, but the right people in place, right? Instead of looking for members to say that you have a mega church, but qualitative people, not quantity, but quality in place. And then also we have to understand the importance of community development, so we can provide a safe place of refuge for people to come, and you have multidisciplines to come in to give holistic care to the person that can be monitored. I think that's a good approach. So what else would you all recommend that we can do to try with $20 million on the table?
One of the things I do right now that brings awareness and attention is I work with an adult daycare, as you know. And the adult daycare has mentally and physically challenged adults. And what I do is I send people every Friday to minister to their needs, their physical needs, their felt needs, and give a little sermon. But most of it is meeting the felt need, Maslow's hierarchy of needs.
Right.
And then every quarter, I make sure we bring all those mentally challenged people that people think are crazy to the church and give them a full church service. And we feed them with no expectation of anything in return. I discovered something very strange, that the average person has never been around a person who's truly mentally challenged. And they are fearful of them when they don't have to be. They are docile. They are calm. They have a sickness and they need treatment. And when you bring them around, I've seen now over 3 years, people that have never been around those people now are just loving and caring around them. So we have to find a way to bridge the gap, community development. Having our people that think they're sane, you think you're sane,
Right.
going into places and seeing how we can literally assist guys like you. Why does the church have to charge for everything? Why can't we set up a ministry to be able to come partner with you and help you in areas so that you can help us understand if they come to us, we can have a bridge to be able to help you guys? Because in many instances, churches have money when your organization doesn't.
I would say it's very hard, was not common to see, say, big corporations go into churches to deliver mental health or even physical health information. I think it's part of the way we see separation of church and state, but also, the liability of the company if something goes wrong or not correctly. They tend to want a more structured type of program.
Absolutely.
And then when it comes to being involved in the black community and how we see things, especially with the church, a lot of them are just completely lost. So they want to stay out. Hopefully they would have an interest, but when they do have an interest, the question becomes, we don't want to be in the wrong spot or the wrong place. But that can be fixed with investment in the right people. It can be fixed with investment in the right people.
Okay.
I think it's even more difficult when it's talking about mental health, even more so than physical health. Too often we're in that mystical area for some reason when we talk about mental health, and also when we talk about the church itself. Another issue that we have in overall mental health and psychiatry is that when it comes to psychiatrists in general, we're the least likely to believe in God.
Yeah.
The least likely of all medical specialties to believe in God is the psychiatrist. Now, when I say that, that's psychiatry in general. Now, most of the black psychiatrists I know do believe in God. The majority would be Christian, but many are Muslim as well. So I would say that I've even had individuals who are other faiths or other races who will come and see me as a psychiatrist because they assume that because I'm black that I understand the word. and they have a biblically based or even some other faith-based issue framework, they can't find anybody in this space, but they assume that the black person can be able to understand, because generally 95% of us are actually practicing some sort of faith.
So what would you say also, Doc, in terms of their comfort zone with you culturally as well? Because, you know, even me looking for professional help for my son, I have to admit I'm more comfortable with someone who is African American, because I believe that you will understand more of the dynamics that transpires in the African American community. Yeah. Do you find a lot of that as well?
Yes, you do. You do. In that there's nuance that we have to go through in our lives, and some other people may not be able to understand. And it's not that they're not good people. It's just that they just never saw it, never dealt with it, aren't around it often enough, or some would even choose to ignore it. There is a level of comfort that you know that the person culturally understands what's going on. I remember once being in training, and it was a black young male was getting in trouble in school, and then the mom made mention of, well, you know, him acting like that, being in that classroom with that white teacher, and she kind of nodded her head, and then and I nodded back, and then my white attending later on after the interview said, "What was that about?" And I was like, "Not much." And the fact is, I don't have time to take you through how we envision white folk, or when you have a black male acting up in the classroom with the white teacher who may not understand the culture.
Right.
I'm like, I just ain't got that kind of time. Nor do I know. I don't necessarily want to tell you my truth, because you may not take that well, and I'm a trainee and I'm not in charge here.
Right.
So those nuances that can occur in our community many times can be missed by others. But I would tell people there are good psychiatrists out there who are not of our color or not of our community. I would say it's important to make sure that you explain where you're coming from, and make sure you're dealing with somebody who's inquisitive, who will ask the question that if they don't understand, they're willing to figure out and find out what's going on with you, so that they can understand what's going on. Yeah.
But you know what I would say? I would think that every individual that has insurance or that could afford it should have a biannual checkup. Just like you have an automobile, you need an oil change, you should go in for a checkup for your mental health care to see where you are and just talk. And the thing is, if we can remove the psych part of it and say, hey, come in for talk therapy. Just come talk to...
I like that.
Yeah, come talk to me and tell me what's going on in your life. And you say, hey, doc, this is what's going on. I've been faced with this, and that at my home. So many kids that are in law school, medical school, I was amazed coming into the facility because they just broke. I mean, they're like, you know, I'm pushing it so hard. My parents want me to do this. I really don't want to do this. I don't want to even be in law school and medical school. And they're not African American. And so I'm thinking, well, wow, here you have everything that you could ever want. Your mom got plenty of money. Your dad has plenty of money. Doctors, lawyers. But this kid is like on the brink of just a nervous breakdown because they're somewhere they don't want to be, but they're afraid to go and say, hey, I don't want to do this. And so you have that. And what about the football player? I'll tell you something I've seen. Football player, he misses a block. Now, you may not think this is anything major. The coach gets at him and screams in his face. You are sorry. You should have done this. You're a punk. You missed your block. Now, to you guys, you know, just in the whole game of...
It was the whole game of the sport.
Yes.
Yeah.
It's
That's what it
nothing
is. Like
major.
dominoes.
But guess what? That same kid can go home from that experience on that evening and he want to commit suicide because everybody's down on him. He's broken now. And there's no one to talk to because everyone has turned on him because they lost the game because he missed a block.
Wow.
Now you say, but he's not mentally ill. No, he's not. But he has an issue now, and he's been broken, and it becomes a psych issue. So what do you do?
Yeah.
So you're saying that most people, when they think of mental illness, they think of, I'm not a counselor, but they think of the triage, what I'm told, 3 level, right, where you're eating out the garbage can. But you say anytime you're emotionally disturbed and broken, that is categorized as mentally A
I
mental
would
health
say
issue.
psychologically.
Psychologically.
Yes.
Well, what I would say is the ability to bounce back.
Okay.
You know, so essentially you're going to have those life's adverse events. I missed the block. I was supposed to do this. I dropped the baton. You know, I missed the ball. I missed the catch. I didn't perform well in front of my peers, my family, and I let everyone down. Most people who are mentally well will hear that, be upset about it, you know, eat dinner, do a few other things, and then, you know, they waking up the next day, you know, apologize to the team, yada, 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 realizing you ain't the only one. If y'all lost the game, I guarantee you it's more than one missed block, all right?
Right.
You know, but after a
Right.
while, mentally, you get it back together and you move forward. Those who are mentally unwell, that type of thing breaks them down. They keep going down with that. So essentially, that ability to bounce back is part of mental wellness.
Yeah.
That, you know, I didn't get accepted into medical school, or I failed the test, or whatever it might be. Now, you also mentioned something that occurs often, especially in professionals, be it medical students, law students, dental students, or just high functioning professionals, is burnout.
Yeah.
You know, a lot of people, you know, will go into those episodes of burnout because you're grinding so hard, you're working so hard, you got the candle burning on both sides, you know, at the midnight hour, and you're trying to get it all done. And sadly, sometimes with that, people feel like they hate what they decide to do, not because they hate the profession, but essentially what it requires, an amount of information that it requires in order to get the paperwork to move forward. So you always have to look out for professional burnout in the work that we do. Most people who are resilient and who are mentally well enough they'll finagle and they'll make it. You know what I mean? I keep studying, I keep taking the test, yada, yada, yada. For those who are not mentally well, then that breakdown starts to happen. But I do believe that sometimes in society we're asking well too much of people.
Yeah.
Dr.
So
Higgins, can I
before
ask
you
him
go
one
right
question?
there-
I want to
Yeah,
ask
go
him a
ahead.
question.
Go ahead. Go ahead.
I
Sure.
just got a question. And maybe y'all can chime in and help me, because I'm thinking about the audience. We had an 11-year-old young man commit suicide in our church. You know, family lower income. He was being bullied at school. Some things happened. He committed suicide. His family was in the home. They found him. They found a young man with scratches all on his neck, because apparently he didn't know that death was really the end. And that mother is hurt, and she has survivor's guilt. As a pastor, what is something you would tell me to share with someone like that who trusts me before they come to you?
Well, the thing is that I don't know how much more tragic in life a circumstance can be than to have a child to commit suicide.
And you find them.
And you find them. One, be there, be understanding, listening, definitely be prayerful. Look out for any onset of mental illness within the mom or the family, making sure that they receive the resources. But at that point, really, the most that you can really do is just be there for them. And, you know, and the odd thing about that, sometimes they want to talk and other times they don't want to talk. So many people are calling, so many people are doing all those different things, and sometimes it's not time. At the same time, after the shock, after the awe of the entire thing, then people disappear.
I need
You know,
to put
so
you
staying there with them. And then grief counseling goes a long ways. You know, grief counseling with a professional is typically where I'm going to try to lead them to.
Great advice. The Suicide Foundation is a great organization
Okay.
that you need to connect with.
Okay.
And they encourage church to have a safe place for suicide survivors. And I remember one time attending 5 years ago, because I thought it would allow me to identify signs and signals, because young in ministry, I thought that, you know, this relationship with God, I would have this prophetic insight, discernment to recognize anybody's problems, right? But this person in the congregation committed suicide that evening. And I questioned my calling as a result of that. But, you know, you learn, you grow. But what they taught me in that meeting is everyone that sat around the table, one question they asked, if I'm the loved one and the caregiver, why didn't I see the sign? The facilitator, by the third person, I was wiped out. I said I couldn't do it, right? Because people were reliving this incident as though it happened yesterday, and it was 3 years, 5 years down the road. And one thing he helped me understand with that was, that the person who's contemplating suicide, they become great actors in front of the person they love, because that's the person who can prevent them from doing it.
That was me.
And what happens is suicide survivors live with the guilt of it, as well as not being able to identify it.
I preached the day before I shot myself.
Wow.
I preached that Sunday,
You disguised it.
and nobody knew it. Nobody had the spiritual discernment. Nobody had the gift of the Holy Ghost. I was functionally depressed. And May 17, 1999, I left and shot myself in the chest with a 12-gauge shotgun. I didn't call you. I called McDuffie Funeral Home. I didn't call my mother. I didn't call the police. He would have been there.
You left no messages?
I left no messages, no notes. I disguised it well. You thought I was okay. Everybody thought I was fine. That's David. He's fine. He just preached yesterday. So I agree 100%. They know how to put on this amazing act like everything's okay. And I believe that's a form of mental illness.
Yeah. Well, the thought of wanting to end your life typically is seen with depression, or more commonly with hopelessness.
Okay.
There is no way out other than that means. And trying to identify that is very hard to, because people hide it so well. I would say just trying to recognize the signs and symptoms of mental illness and letting people know it's okay to reach out, that it's not a weakness, it's an illness. Whenever you get to that point, that is definitely a mental health, mental illness issue that needs to be definitely treated. But so often people don't even know that they have a problem.
That's right.
Because of lack of knowledge and information. And what you all have said about education, especially in the churches and our pastors. I know so often in our communities, we pick pastors on how well they pray and how well they dress. You know, he can sing good and he got wavy hair. So,
Yeah.
that must be the man of God for us. But even if that be the case, there definitely needs to be a level of training. Now, most pastors that I know are well trained. You know, they went to school, they got educated, they know social situations, social work, recognizing mental health and all of that. But not all, not all. But leaving that door open, and I think that if there was less stigma, we would be a whole lot better.
So we're about to come up to a wrap up. Mr. Troy, thank you for being with us. Go ahead and give some last remarks.
Well, I just think that when it comes to pastors, and I'll make this real quick, when it comes to pastors, you guys have to deal with so much on a daily basis. So imagine all of the information from different people that are coming to you, and all that comes to you. That's a buildup, and how do you get rid of that? And so you need more than anybody, you guys need to seek counseling, healthcare, psychiatry quite often. Just not in a bad way. Not in a bad way.
No. And Troy, you are absolutely right. That's why every 2 weeks I go and see my discipler, Dr. Joe Parle, because I know that I could combust at any time if I don't have an outlet. So I agree with you 100% that I need someone I need to be vulnerable to too.
Thank you. We had such an awesome discussion today. I thoroughly enjoyed myself. I learned a lot of information. I think we're on a good path of sharing this and having this conversation, talk about it. Thank you. I'm your host, Reverend Dr. Carl Matthews, and we can send a shout out to our good friend, Reverend Dr. Robert McKinley Gilmore Sr. It's a blessing. We look forward to you coming back, being with us. Thank you for being with us today. God bless you. Until next time.